In this video, we're going to highlight our 6-week cervicogenic headache program. We're going to define cervicogenic headache, and we're going to hear from some patients of ours that have been through our cervicogenic headache program. Let's get into the video and take a look. Welcome back to another episode of Physio Tips with Mauro. I'm your host, Mauro Burnett. And for those of you that don't know me, I'm a board-certified orthopedic specialist in physical therapy and the owner of Australian Physiotherapy Specialists in Jacksonville, Florida in the USA. For today's video, we're going to talk about our 6-week cervicogenic headache program that we have at our clinic. It's one of our specialized programs. It's very popular. We get tons of patients every week that come in for this. Our patients oftentimes suffer from frequent headaches that also accompanies pain in the upper neck, especially the upper 3 joints. When the upper neck is sore, it connects to a host of nerves that can radiate pain off to the head and face. Nerves like the occipital nerve. This can cause pain to creep into the back of the head. It's pretty terrible. The trigeminal nerve is another nerve that has 3 branches. It goes to the forehead, sinus, and the jaw, and this can cause some pretty terrible pain as well. I just wanted to say, if you feel like you're getting value from this video, do us a big favor. Don't forget to hit that like button below, and don't forget to subscribe to our channel so you can receive more videos like this in the future on physical therapy related tips. All right, let's get back to the video. Well, thanks for being on video. We just want to talk a little bit about how your headache treatments have been coming along. You've been in therapy for how many visits now, approximately? 6 visits, great. And could you just tell us a little bit about how your headache frequency has decreased since you've started therapy?
It has decreased about 40% less for me with the migraine headaches.
Awesome. And have you found the exercises pretty doable, not too difficult?
No, not difficult at all. You can do these every day at home yourself. Just make sure you just do it daily, and with that, the headache frequencies will go down for you.
That's awesome. And how did you hear about our therapies?
I was referred to this office by Dr. Tongence.
Okay, at Baptist Neurology?
Yes.
All right, well, thank you so much for your feedback, and I'm glad you're feeling better.
Thank you.
Our 6-week cervicogenic headache program is based on the research of world-renowned neck expert Dr. Gwendolyn Jewell from University of Queensland in Australia. Dr. Jewell has published over 300 publications, many of them on the topics of cervical spine, whiplash, headaches, etc., and have been a keynote speaker internationally, over 100 speaking engagements. I've had the pleasure to be able to study with Dr. Gwendolyn Jewell personally, and we've been able to apply her concepts to our patients. In a 2002 randomized control trial research study conducted by Gwendolyn Jewell et al., they found that 6 weeks of using gentle specific stabilization exercises as well as gentle manual therapy, that this decreased cervicogenic headache symptoms, decreased the intensity, the frequency, and the duration of the headaches, and the results were maintained at a 6-month and 1-year follow-up. This is the exact approach that we use here at our clinic at Australian Physiotherapy Specialists. How have things been going?
Great.
Well, could you tell me a little bit about your headache frequency before therapy versus now?
Before therapy, I was spending maybe 20, 25 days a month with the migraine, whereas now maybe 3 to 5 days.
That's fantastic. And you mentioned you were having dizziness and tinnitus along with your neck pain, is that right?
Right, dizziness, tinnitus, ringing of the ears, which is basically completely gone down.
That's fantastic.
As opposed to before therapy where it's like constant.
And your dizziness, how's that done so far?
Excellent as well. The only time I'm dizzy now is during the duration of the migraine, and after that, it's gone.
Awesome. And what do you find the exercises pretty doable, not too difficult to do in our therapy?
Nope, they're easy. You can do them several times throughout the day, and they do help with the symptoms that go along with the migraines.
That's fantastic. Well, thanks for your feedback. We really appreciate it. I'm so glad you're feeling better. For cervicogenic headache, A lot of experts believe the trigeminal cervical nucleus, a region in the upper cervical spine where the sensory nerves of the upper neck, C1, C2, and C3, connect to the trigeminal nerve, a nerve that refers pain off to the head and face. 3 branches consist of the trigeminal nerve. The first branch goes to your forehead, second branch into your sinus cavity, could present pain in the sinus area, around or behind your eye, and the third branch goes into your jaw and face, could even cause TMJ tightness as the trigeminal nerve controls the tightness of your chewing muscles. This is what many experts believe, how the neck and pain in the upper neck can easily transfer pain off to the head and face and cause a pretty terrible headache. Well, thanks for being on camera this morning. Do you mind telling me a little bit about how your headaches have done since we've started treatment?
They have gotten a lot better. They've actually gone down about 70% in pain, which is really awesome because for about 3 or 4 years I had been suffering with migraines and very severe headaches, and I thought I was just gonna have to live with it forever. So,
well, that's fantastic news. I'm so glad to hear that. And you were telling me originally you were having a lot of pain in the sinus area as well. Tell me a little bit about that.
yes, so for a while I always just thought I was allergic to dairy or that I was having sinus issues since I was a child, and so I would go to all these ENT doctors and we would do all these CT scans for probably about 1.5 to 2 years, and we just couldn't find anything. And eventually we even tried to go and do a procedure where they froze my mucus gland productive, and that didn't even help. And eventually I decided to try some neck and back therapy, and ever since doing that, my sinus pain and my sinus headaches, all of that has almost gone away completely.
Wow. So since we started doing the neck therapy you're doing currently, it's really helped your sinus pain?
Yes.
That's fantastic. Very good. And do you find the exercises pretty easy to do? Are they real cumbersome, or?
They are really easy to do, and they're really easy to do just about anywhere.
That's very, very good news. I'm so glad to hear it. I'm so glad you're feeling better, and thank you so much for being on camera.
Thank you.
Well, thanks for watching today's video on our Cervicogenic headache program. I hope you enjoyed it. I hope you got something out of it. If you did, do us a big favor. Hit that like button below. You can always subscribe to our channel to receive more videos like this in the future, or share it with your friends. It's goodbye for now, and we'll see you next time on Physio Tips Tomorrow.